The following is a comprehensive report on the escalating public health situation in South America and the Atlantic, where an aggressive surge in hantavirus infections has triggered international alarms. We begin with a developing crisis aboard an expedition cruise vessel and a significant statistical spike in cases across the Patagonia region. As of May 2026, the World Health Organization and the Centers for Disease Control and Prevention have confirmed a multi-country cluster of Hantavirus Pulmonary Syndrome, or HPS, linked to travel in Argentina and Chile. The focal point of this international investigation is the Andes virus, a specific strain of hantavirus that is uniquely dangerous among its peers. While most hantaviruses are transmitted solely from rodents to humans, the Andes strain is the only known variant capable of person-to-person transmission, typically through close or prolonged contact. This biological reality has transformed a localized environmental risk into a complex logistical challenge for health agencies across 3 continents. +2 public health surveillance data indicates that the situation in Argentina has reached a critical threshold. In the current season, which began in June 2025, the country has recorded one of its highest infection rates in nearly a decade. Reports from the Argentine Ministry of Health confirm that cases have nearly doubled year over year, rising from 57 infections in the previous period to 101 confirmed cases in the current cycle. The lethality of the virus remains a primary concern for clinicians. The case fatality rate has increased by approximately 10 percentage points compared to the previous year, with at least 32 deaths recorded nationwide. While Patagonia has historically been the endemic heart of the virus, surveillance teams are now identifying significant activity in central regions, including the province of Buenos Aires. This geographical expansion is being closely monitored by infectious disease specialists, who point to a convergence of environmental factors, including habitat destruction and shifting climate patterns, which appear to be altering the behavior and range of the primary rodent reservoir. +2, the gravity of this surge is best illustrated by the ongoing emergency involving the MV Hondius, an expedition cruise ship that departed from Ushuaia, Argentina on April 1. What began as a routine voyage to the Antarctic and remote South Atlantic islands has evolved into a maritime quarantine scenario. A cluster of severe acute respiratory illness was first detected among passengers in early April, leading to a cascade of medical evacuations and laboratory investigations. As of the second week of May, the World Health Organization has documented 8 cases linked to the vessel, including 6 laboratory-confirmed infections and 2 probable cases. The outcome for those infected has been severe, with 3 confirmed deaths and at least 1 passenger remaining in critical condition in intensive care. The high mortality rate seen in this cluster, roughly 38%, is consistent with the historical severity of Andes virus infections, which often progress from flu-like symptoms to total respiratory failure within days. This report will detail the mechanisms of this outbreak and the rigorous containment efforts currently underway as the vessel reaches European waters. The core developments of this outbreak trace back to a specific timeline of exposure and international transit. The index case, identified as an adult male who had spent 3 months travelling through rural areas of Argentina and Chile, boarded the MV Hondius in Ushuaia. His symptoms began on April 6, characterised by fever and gastrointestinal distress, and he died on board just 5 days later, because the Andes virus can be transmitted between humans. Health officials are investigating whether the subsequent cases on the ship resulted from initial environmental exposure in Patagonia or from secondary transmission within the confined environment of the vessel. Following the death of the index case, a close contact, an adult female, was offloaded at the British Overseas Territory of St Helena after developing similar symptoms. Further medical emergencies followed, including a male passenger who was air evacuated from Ascension Island to a specialised facility in South Africa. It was in a South African laboratory where polymerase chain reaction, or PCR, testing first confirmed the presence of hantavirus, later sequenced as the Andes strain. +2. The international response has been swift, involving the national international health regulations, focal points of the United Kingdom, the Netherlands, and South Africa. As the ship moved north through Cabo Verde toward the Canary Islands, medical teams from the CDC and the European Centre for Disease Prevention and Control prepared to intercept the vessel. In Tenerife, Spanish authorities have designated the industrial port of Granadilla for disembarkation, where passengers and crew from 23 different nations are being screened and processed for repatriation. This logistical operation is one of the most complex hantavirus-related interventions in recent history, as the 45-day incubation and monitoring period for the Andes virus requires extensive follow-up. While the ship was at sea, the crew was instructed to implement strict infection control measures, including the use of N95 respirators for any staff entering the rooms of symptomatic patients, and the elimination of dry sweeping practices to prevent the aerosolization of viral particles. +2 simultaneously, in the province of Salta and the southern regions of Patagonia, Argentine technical health teams are conducting field surveillance. These teams are focused on capturing and analyzing the long-tailed pygmy rice rat, the primary carrier of the virus. In the Oran department of northern Argentina, a localized surge of 12 cases and 2 deaths earlier this year has already put the regional healthcare system on high alert. Infectious disease advisors suggest that the increase in human interaction with wild environments, combined with the establishment of small urban settlements in previously rural areas, is driving the current spike. Experts such as Eduardo Lopez have noted that the rodents are adapting to extreme weather phenomena, such as intense rainfall and rising temperatures, which may be facilitating the presence of the virus in areas previously considered low risk. Laboratory analysis of the current samples is ongoing at the Anlis Malbrán Institute in Buenos Aires to determine if any genetic mutations in the virus are contributing to its increased transmission or lethality. As the international community grapples with this surge, public health guidance has been reinforced for residents and travellers in endemic zones. The primary mode of transmission remains the inhalation of aerosols from rodent excreta, such as urine, feces, or saliva. Health officials emphasise that preventive measures are the most effective tool in the absence of a specific vaccine or antiviral treatment. Guidance for individuals in Patagonia and central Argentina includes the rigorous ventilation of closed structures, such as sheds or cabins, before entry. Experts recommend opening doors and windows for at least 30 minutes and using a bleach solution to disinfect surfaces rather than sweeping or vacuuming, which can kick up contaminated dust. For those camping or trekking in high-risk areas, the use of tents with ground sheets and the storage of food in rodent-proof containers are considered essential protocols. +1 despite the intensity of the cruise ship cluster and the rise in domestic cases in Argentina, the World Health Organization maintains that the global risk to the general population remains low. The virus does not spread easily through casual contact. Rather, it requires the type of close, prolonged interaction often found in households or confined shared spaces like a ship. However, there is a clear acknowledgement of the limits of current knowledge regarding the specific triggers of the Patagonia surge. Surveillance is complicated by the remote nature of the terrain and the rapid onset of the disease, which can mirror common influenza in its early stages before suddenly progressing to pneumonia and shock. This window of ambiguity makes early clinical recognition vital, as supportive care, including mechanical ventilation and oxygen therapy, is currently the only way to manage severe outcomes. +3 The declaration by some outlets that certain regions are now uninhabitable represents an exaggeration of the current official stance, yet it underscores the palpable anxiety surrounding the virus's recent behaviour. National health agencies have not issued travel cancellations for South America, but they have heightened the advisory levels for those engaging in rural activities. As the passengers from the MV Hondius are repatriated and monitored, the focus remains on containment and the scientific understanding of the Andes virus's environmental drivers. The global health community continues to monitor these developments with caution, balancing the need for public vigilance with the reality that the risk is manageable through proper hygiene and environmental awareness. Future reporting will rely on the results of ongoing genomic sequencing to confirm if the current strain poses any new biological challenges. For more updates on global health surveillance and emerging outbreaks, consider subscribing to this channel. The logistical and clinical investigation into the current hantavirus surge focuses heavily on the timeline of the MV Hondius, a vessel that has become a mobile laboratory for understanding the Andes virus's transmission dynamics. According to the World Health Organization's outbreak news, the sequence of events began when a passenger, who had spent significant time in the endemic regions of Patagonia, boarded the ship in Ushuaia. This individual represented the index case, succumbing to Hantavirus Pulmonary Syndrome on April 11 while the ship was in transit. The core challenge for investigators remains the unique biological profile of the Andes strain. Unlike its North American counterparts, such as the Sin Nombre virus, the Andes variant is the only hantavirus documented to spread via person-to-person contact. This prompted immediate interventions by the UK Health Security Agency and the Dutch Public Health Authorities as the vessel travelled through the South Atlantic. Medical records from the ship indicate that symptoms among the subsequent cases emerged in two distinct waves, suggesting either a common environmental exposure point in Argentina or a secondary transmission chain occurring within the ship's enclosed corridors and dining areas. While international attention is fixed on the maritime quarantine, the domestic situation within Argentina's health infrastructure reveals a broader systemic strain. The National Administration of Laboratories and Health Institutes, known as ANLIS Malbran, has been working at an accelerated pace to process samples from across the country. Data from the Argentine Ministry of Health shows that the surge is not confined to the southern provinces of Chubut and Rio Negro. In the northern department of Oran, Salta, health officials have confirmed 12 cases with a fatality rate exceeding 15%. This geographical divergence is a primary concern for the ministry's epidemiological surveillance units. Clinicians in these regions report that the forbidden zone rhetoric found in some media outlets is a hyperbole that complicates public health messaging, however. They acknowledge that the Alert Level 4 status in specific rural sectors is unprecedented. Hospitals in these endemic zones have been instructed to prioritise patients presenting with sudden onset fever, myalgia, and gastrointestinal symptoms, particularly if they have a history of exposure to rural outbuildings or wood piles. The laboratory angle is critical to understanding the severity of this specific outbreak. PCR testing and genomic sequencing performed on samples from the evacuated passengers have confirmed a high viral load, which correlates with the rapid progression from initial flu-like symptoms to full respiratory distress syndrome. In South Africa, where one of the cruise passengers was air evacuated, specialists noted that the patient required extracorporeal membrane oxygenation, or ECMO, within 48 hours of admission. This rapid clinical decline is a hallmark of the Andes strain and explains why the case fatality rate currently sits between 30 and 40% in confirmed clusters. Furthermore, the Argentine Ministry of Health has reported that at least 70% of the recent domestic cases are males between the ages of 20 and 50, a demographic typically involved in agricultural or outdoor labour where contact with the long-tailed pygmy rice rat, the virus's primary reservoir, is most frequent, contrasting the sensationalist claims of a total regional shutdown. Official statements from the provincial governments of Patagonia emphasise targeted containment. There is currently no official ban on life in these regions, but there is a strict enforcement of health protocols in the peri-urban areas where wild habitats meet human settlements. International shipping and travel logistics have also been impacted. The Spanish Ministry of Health coordinated the docking of the MV Hondius in a controlled industrial area of Tenerife, specifically to prevent any contact with the local population until the 45-day monitoring period was addressed for every pass. The CDC has dispatched a team to assist in tracing the contacts of the 23 different nationalities represented on the ship, highlighting the global scale of the surveillance effort. This coordination between the CDC, WHO, and local South American health ministries represents the most intensive hantavirus response effort since the 1995 El Bolson outbreak. As experts look for definitive proof of whether environmental shifts are creating more virulent viral sublineages, The escalation of hantavirus cases in South America and the subsequent maritime quarantine underscore a critical gap between environmental risk and public health preparedness. As the World Health Organization and regional ministries of health work to contain the current surge, the emphasis has shifted toward rigorous prevention and the management of public expectations. While sensationalist headlines may suggest that vast swathes of Patagonia have become uninhabitable, officials clarify that the risk is manageable through specific, evidence-based interventions. The primary challenge lies in the nature of the virus itself. Hantaviruses are not hardy outside their hosts, but are extremely volatile when disturbed. Because the virus is transmitted through the inhalation of aerosolized particles from the urine, saliva, or feces of infected rodents, specifically the long-tailed pygmy rice rat, prevention focuses almost entirely on dust suppression and ventilation. Public health guidance issued by Argentine and Chilean authorities now mandates that any closed or abandoned structure in endemic zones, such as summer cabins, sheds, or storage units, must be ventilated for a minimum of 30 to 60 minutes before entry. This allows potentially contaminated air to dissipate, significantly lowering the viral load in the environment. Beyond ventilation, the technical guidance for cleaning contaminated areas is precise. Health agencies strictly forbid the use of brooms or vacuum cleaners in suspected rodent-infested areas, as these tools launch viral particles into the breathing zone of the individual. Instead, a decontamination protocol involving a solution of 1 part bleach to 9 parts water is recommended. Surfaces must be thoroughly sprayed and left wet for at least 30 minutes to ensure the lipid envelope of the virus is deactivated before it is wiped away. For those engaged in high-risk activities, such as agricultural labour or cleaning outbuildings in the provinces of Chubut or Salta, the use of N95 or N100 respirators is no longer a suggestion but a necessity. The efficacy of these measures is proven, yet the human element, the failure to recognise a space as potentially hazardous, remains the weakest link in the chain of prevention on the surveillance front. The international community is closely watching for signs of genetic drift in the Andes virus. The Malbrán Institute in Buenos Aires continues to conduct ecological studies to determine why the rodent population has seen such a significant spike this season. Biologists point to the cyclical abundance of seeds and environmental shifts that may be driving rodents closer to human dwellings. However, the limits of current medical science remain a sobering reality. There is currently no globally approved vaccine for hantavirus, nor is there a specific antiviral drug that can reliably halt the progression of Hantavirus Pulmonary Syndrome once it has reached the lungs. The clinical management of the disease remains entirely supportive, relying on early hospitalization and, in severe cases, the use of extracorporeal membrane oxygenation to oxygenate the blood when the lungs fail. This lack of a silver bullet treatment places an immense ethical and practical burden on surveillance systems to detect clusters early. As seen with the rapid response to the MV Hondius, the ethical dimension of this reporting involves balancing the reality of a dangerous pathogen with the socio-economic needs of the regions involved. While the surge is statistically significant and the mortality rate is high, the forbidden zone rhetoric is often counterproductive, leading to panic rather than precaution. Public health officials emphasize that life in these regions continues, provided that residents and visitors adhere to the established living with the virus protocols. This includes the elimination of rodent shelters near homes, the proper sealing of food containers, and the maintenance of a perimeter cleared of tall grass and debris. As the investigation into the Atlantic cruise ship cluster concludes, and the passengers complete their mandatory observation periods, the focus will return to the source, the rugged landscapes of the South, where the virus persists in its natural reservoir. The goal for 2026 remains the same as it was decades ago, to move from reactive crisis management to proactive environmental control. For further updates on this developing story and more in-depth reporting on global health security, please consider subscribing to this channel.